In 2020, the most severe health crisis in decades took hold and spread throughout the United States and much of the world. America's healthcare system was stretched to its limits by the COVID-19 pandemic, but it did not break. Healthcare professionals of all kinds rose to the occasion, offering compassionate care to millions of patients whose lives were in the balance. Much of this care was provided by the nation's 3 million plus nurses at considerable sacrifice to themselves and to their families. They have been the real and acknowledged heroes of the pandemic. AMN Healthcare, the leader in healthcare workforce talent solutions, is proud to have partnered with many of these dedicated caregivers, placing thousands of nurses and other healthcare professionals where they were most urgently needed. One of the most critical COVID hotspots early in the pandemic was New York City, which was shut down by the virus. AMN responded through an all-out effort on behalf of our clients. Within just 1 week, AMN had placed more than 650 nurses and other healthcare professionals at New York City health facilities, the great majority of whom provided direct patient care to COVID patients.
The number of hours that the team put in was extraordinary. The commitment that they had to put in to make sure that not only AMN was supporting NYP, but these team members live in the community. So they were supporting the community that they live in. They were putting in 15 to 20 hours a day, 7 days a week. They had family members that were in the hospital that they were trying to keep tabs on while they were still trying to support the hospital as well as the city.
I think it's important to remember that we're all here to make sure that the patients have the care that they need. In a crisis and you've got 5, 6, 7 patients, it's overwhelming and it's too much. That's why companies like AMN exist, to make sure that the staff nurses aren't burnt out, to make sure that they're not handling too many patients at a time, to make sure that the patients have the care that they need to get well.
When AMN asked me to stay in New York during COVID, that was the easiest decision I ever made in my whole life. This is my home state. They needed me here. I'm a respiratory therapist. I stayed. It was really an amazing thing to see the capacity for human potential of working together and creating something, where the sum is greater than its parts.
I think as healthcare providers, we know things can get dangerous and get scary, but it's really, really hard to turn your back on your coworkers and the patients when you can tell that you're exactly what's needed. I wouldn't trade it for anything.
New York City illustrates just one of many success stories where hospitals, medical groups, caregivers, and healthcare staffing professionals worked together to provide patients with care where and when they needed it. These partnerships continue throughout the country, ensuring timely delivery of care, not just to COVID patients, but to patients of all kinds, wherever the need is the most urgent. AMN Healthcare is proud to have placed thousands of nurses, respiratory therapists, surgical techs, and other healthcare professionals as part of America's healthcare staffing response to the COVID-19 pandemic.